Hello, everyone. Welcome back to our Literature Digest series on important allergy immunology scientific publications from Allergy News. Today, we discuss a publication by Drs. Sharon Eluwalia and Elizabeth C. Matsu on topic indoor environmental interventions for furry pet allergens, pest allergens, and mold, looking to the future. Dr. Sharon Eluwalia is an assistant professor of pediatrics and medicine at Uniformed Services University of the Heath Sciences, Bethesda, Maryland Allergy, Immunology, and Immunization Service at Walter Reed National Military Medical Center. Dr. Elizabeth C. Matsu is professor of pediatrics, epidemiology, and environmental health sciences at the Division of Pediatric Allergy and Immunology, Johns Hopkins School of Medicine, Baltimore, Maryland.
Hey everyone, and welcome to this deep dive. We are going to be looking at the impacts of indoor allergens on asthma, especially for those of us living that urban life. It's kind of crazy how we spend, 90% of our lives indoors, according to the EPA?
Yeah, that's a lot.
It is. We don't always think about, how that impacts our health.
Right.
And to help us understand this, we're going to dive deep into a fascinating research study called Indoor Environmental Interventions for Furry Pet Allergens, Pest Allergens, and Mold, Looking to the Future.
This study is really great because it looks at ways that we can reduce those allergens and hopefully improve asthma outcomes, for folks dealing with asthma.
Absolutely. So let's start with the obvious. Our furry friends, cats and dogs. We know they can trigger allergies, but did you know about half of all households in developed countries have pets?
Yeah, so exposure to those pet allergens is incredibly common.
It is.
And people think if they don't have a pet, they're safe. But those allergens, those tiny proteins, FeLD1 from cats and CanF1 from dogs, they can stick around for a long time.
Oh, wow.
Even after the pet's gone, they're in the air, on surfaces. You could be exposed at school, at the office.
So even if I'm visiting a friend, I could be bringing those allergens back home with me.
Absolutely. And if you're sensitive to these allergens, that exposure can make your asthma symptoms so much worse. More wheezing, coughing.
Oh, for sure.
It's really important to be aware of it.
Okay, so, I've heard pet owners talk about those hypoallergenic breeds.
Right.
I always thought all cats and dogs produce allergens. So is there any truth to that, or is it just clever marketing?
Unfortunately, a truly hypoallergenic breed, that's a myth.
Okay.
Some breeds might produce a bit less allergens, but studies have shown that even those marketed as hypoallergenic can still have high levels.
So no escaping those allergens, even with certain breeds. All right, let's move on to, a less cuddly allergen mice. I was surprised to learn that mouse allergen is more common in urban environments than I thought.
Yeah, it might seem counterintuitive, but it makes sense when you think about it. Mice like older buildings,
right?
Cramped spaces,
Oh,
places
wow.
where they can easily hide. And the main mouse allergen, MUSM1, it's found in their urine. And it travels on tiny particles and gets in the air, stays suspended for quite a while.
Oh, wow. So these allergens can spread throughout a building even if you don't actually see the mice.
Exactly. And it gets even more interesting. Research has shown that mouse allergen levels can be 1,000 times higher in low-income urban areas compared to the suburbs.
Wow, that is a huge difference. So where you live can really impact your exposure to these things.
Absolutely, it does. And it goes beyond, how well someone cleans their home or manages pests. There's a societal aspect to consider.
For sure. So with these mouse allergens being so common and persistent, I'm sure people are wondering what they can do. What can we do about it?
Well, one thing that's showing promise is IPM.
IPM.
Integrated pest management. And IPM goes beyond just setting traps or spraying.
Okay.
It's about being proactive, sealing entry points so they can't even get in,
Right.
meticulous cleaning to get rid of those allergens that are already there,
Wow.
and careful food storage so you're not giving them a snack bar.
Right. So make your home less inviting to them in the first place. I like that.
Absolutely. And the research supports it. One study showed that using insecticidal bait alone as part of IPM led to a big reduction in cockroach exposure, 80 to 90%.
Oh, wow.
Yeah, so even a simple targeted approach can really work.
That's good to know. So let's talk about dampness and mold. I think we all know mold isn't good.
Yeah.
But how does it impact asthma specifically?
Dampness is like an invitation for mold to just move right in. And mold releases spores, and those spores can act as allergens, triggering a whole cascade of reactions in your immune system.
Oh.
And that leads to, well, those asthma symptoms.
So it's not just seeing the mold, it's those tiny spores that we might be breathing in.
Exactly. Each spore is like a tiny package of allergens waiting to cause problems, and some molds are worse than others. Aspergillus fumigatus, it's a common one found indoors, and it's linked to pretty severe asthma in adults.
That's scary. Dampness and mold. Definitely not something to ignore. So how do we fight back, considering the connection to dampness?
Moisture control is key. Fix leaks fast, make sure there's good ventilation so moisture doesn't build up, and keep humidity levels in check.
All good tips. And what about mold that's already there?
If you can see it, you got to remove it, and you got to do it safely. AIOH recommends wearing at least an N95 mask while cleaning to protect yourself from those spores.
Oh, good tip. I'm glad you mentioned that. Any other preventative measures you'd recommend?
A well-maintained HVAC system with good filters can be really effective in filtering out those outdoor mold spores so your indoor air is cleaner. It's like creating a multi-layered defense for your home.
So it's about controlling moisture inside, but also like being mindful of what's coming in from outside too.
Yeah, exactly.
Okay, so this brings us to a fascinating study, the Inner City Asthma Study, or ICASE. This one provided evidence that multifaceted interventions addressing multiple triggers can really improve asthma outcomes, especially for kids in cities.
It was a really important study. Showed that tackling dust mites, cockroaches, and pet dander at the same time led to a significant reduction in symptoms, even fewer visits to the doctor or the hospital.
But thinking practically, is going after all allergens at once the only way to make progress?
Well, it's not the only way. Multi-allergen interventions are great, but they can require a lot of resources and can be hard to implement, especially in large community programs.
So maybe focusing on just one at a time is more doable.
Yeah, and research is backing that up. Recent studies have shown that focusing on just mouse or cockroach allergens can improve asthma control.
Wow, that's promising. It suggests that even targeted, smaller interventions can make a real difference. But are these interventions typically covered by insurance?
That's where things get tricky. There's not enough data to show how cost-effective these interventions are yet, and that makes it harder to get insurance companies on board.
So we have the evidence they work, but getting them covered is a whole other thing.
It is, but there's growing awareness of the high cost of untreated asthma, and the focus is shifting towards preventative care. We are starting to see some promising developments.
Oh, good.
Pilot programs are looking into new ways to pay for environmental interventions, realizing that spending on prevention can save money in the long run. It's slow, but things are moving in the right direction.
That's encouraging to hear. So before we wrap up this part of our deep dive, I'm curious about single allergen interventions in places like schools.
Great question. Recent research has highlighted a link between high allergen levels in inner city schools and increased asthma morbidity among students.
Oh, so the impact extends beyond the home.
Absolutely. This really underscores the need to think about broader interventions in shared spaces like schools, especially in communities where asthma is more prevalent.
It really makes you think about how much these allergens in schools are impacting kids' ability to learn and just, feel healthy.
It's an area that definitely needs more research and attention.
That's fascinating. We've covered so much in this part of our deep dive, from those furry pet allergens to mold and different types of interventions. But stick around, because we're just getting started. When we come back for part 2, we'll be exploring how broader societal factors influence allergen levels and asthma outcomes.
We'll be diving deeper into the complex relationship between our environment, our health, and the systems that shape both.
That wraps up part 1 of our deep dive. We've covered a lot today, from furry pets to mold and pests, and how these indoor allergens can seriously impact asthma, especially for those of us living in cities. Be sure to join us for part 2 in our next video, where we'll explore how broader social and environmental factors influence allergen levels and asthma outcomes. This summary was AI-generated based on real research published in a peer-reviewed scientific journal. For a full and detailed understanding, we encourage you to check out the original study. Thanks for watching. We're WikiAllergies, and we'll see you in the next video.